You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial plastic surgery or non-invasive or minimally invasive facial rejuvenation. With us, we have San Diego's facial plastic surgeon, Dr. Gilbert Lee. Dr. Lee, welcome to the program.
Thank you, Randy. It's great to be here. I'm really excited to share with you about all the great things we have in our practice.
Now, before we get into today's topic, tell me a little bit about your practice. Who's the typical patient and what are the different services you offer?
Well, Changes Plastic Surgery is a comprehensive plastic surgery practice. We've been in practice for over 20 years, and we treat a variety of conditions among the whole gamut of plastic surgery, but we have a special emphasis in facial rejuvenation.
And by the way, we said that we were going to let you show some of your before and afters today.
I'm happy to share them with you.
And people need to know, it's a real interview, but these are dramatic, like extreme makeover, very natural results.
Randy, some of these are going to blow your mind.
Okay.
I'm really excited to show it to you. But our patients start from 20 years old, and my oldest patient, I think, is 90 years old. And we have a whole range of services to accommodate what each generation or each type of patient needs.
Are the patients that are coming in getting younger and younger or older and older?
That's a great question. And in fact, what I'm seeing is a huge divergence. The people that are taking care of themselves are looking younger and younger, and the people that are not are looking older and older.
Okay.
So I have seen people in my practice that are the exact same age. They can look 20 and 30 years different. It really is important for you to pay attention to the maintenance of yourself. And I'll give you an example.
Okay.
If you have a car and it's 20 years old, it's a classic, but it's been sitting outside and you haven't done anything to it, it's going to look older.
Okay.
If you've taken that car and you've polished it, you've tuned it up, made sure the tires are balanced and tuned and it's honed, it looks like a beautiful classic. When I hear these comments all the time, people say, "Oh, I was sitting at dinner and I saw it. The facelift that lady walked in there."
Yeah, I feel like I could spot a facelift walking down the street.
Absolutely. But
that done look.
But what you're missing is the 100 people that walked by you that also had beautiful facial rejuvenation that they didn't stand out and catch your eye, but they looked great. And that's where the new concept of facial rejuvenation comes in rather than plastic surgery.
So tell me, when you look at the aging face, and you told me on the telephone, you got 30s, 40s, 50s, they all have different issues, but when you look at the aging face, and let's take the woman, let's say 45 plus, right? What are you looking at?
I see the exact same thing that you see and that everyone else sees. The only difference is that I can see it and verbalize it and understand what I'm seeing. You can see from across the room the age of a patient. You can tell by their hair color, you can tell by the shape of their face. If they have a heart-shaped face, that's a youthful shape. What happens as we age is we start to get atrophy of our fat. Do you know we lose a teaspoon of fat for every year we age after the age of 30?
Okay.
Okay? But I know where that's going to be lost. You're going to lose it in your temples, in what we call the tear troughs, the nasolabial folds. Our cheek areas are going to start to deflate. Our cheeks become sallow. We lose it in the marionettes. Our lips thin and implode. It's a very predictable pattern. And so we see it across the room, and you can see that person's a little older, that person's a little younger. So our goal, what happens is as you age, this heart-shaped face starts to turn upside down, and you get thinner temples. Okay. You get wider jowls and hanging skin. And so what I try to do is I try to reshape it and get you back to the heart-shaped face again, that beautiful contour to the cheek and jawline, fuller temples, fuller malar regions. That's your cheeks.
Okay, so you're a board-certified plastic surgeon.
That's correct.
But in your practice, you have a big emphasis. You have all the lasers, all the IPL, and we were talking on the phone. You say that you have an advantage.
Facial rejuvenation, not plastic surgery, but facial rejuvenation requires a whole breadth of services.
Okay.
it starts with facials and skin maintenance and great skin products. We have to be able to treat sun damage with lasers, dermabrasion, light chemical peels, microdermabrasions. We have to be able to restore volume and shape with fillers or fat grafting. And then when patients develop sagging or bags under their eyes, we have our surgical outcomes. But you know, interestingly, I may see 45 patients a week for facial rejuvenation, but only a handful of those might need surgery. The huge majority of people now getting facial rejuvenation are non-surgical patients.
You told me the results you're getting today are so much better than you were getting 20 years ago as a board-certified plastic surgeon. Absolutely. How so, specifically?
If you went back 20 years, basically plastic surgeons had the facelift. And when that wore out, you got another facelift. And when that wore out, you got another facelift. So experienced plastic surgery patients would have this tight drum-like appearance to their face, the same face that you see from across the room, but they didn't look youthful. Why didn't they? Because the surface of the skin still looked a little bit weathered, or they looked sallow, but just pulled tight over a skeleton almost. Now we're into shape and softness. If you think about a baby's face, it's soft. It's got lots of fat and padding. That's a sign of youthfulness.
Now, but you said also you can overfill, because you know there's a lot of people filling now, and give them an odd look.
Okay, we're going back to the table analogy. Too much of any one of these things makes the table unbalanced. And when we think about shape and volume, I think of we're born with a certain gas tank, if you will, of fat in our face. And as we age, we deplete that tank. Well, we can fill that back up, but you never want to overfill your tank. The second that happens, it's a visible sign from
You look odd. Now, you brought photos of some of your work. You know, pretty dramatic here.
Right. I'm really excited to show them to you, Randy.
Now, do you show these? I mean, when patients come into your office, let's say for you know, facial rejuvenation, you show them these photos?
I show them these photos, but more importantly, you know what I show them? I show them a photo of what they're going to look like. We have the coolest thing. It's called a Vectra 3D imager. It's a three-dimensional imager. It takes a photo of the patient, and I can show them what they look like now and what they're going to look like when we're done. It's 6 cameras and flashes. You sit there, and they all fire simultaneously. The computer then generates a three-dimensional image. We can rotate it up and down, inside, outside. You can see all the way around.
Now, what I'm looking at right there,
Are
you saying that that's pretty accurate of what that woman can look like?
It is really accurate. And in fact, we can usually do better than what the imager portrays. Think about this. Would you walk into a dealership and they're trying to sell you a car and you don't get to look at the car?
Okay.
Wouldn't it be nice to get inside and see what it feels like and look like and kick the tires?
Diagnosis, I guess, of what needs to be done is the key. And some people, I guess, because of the internet and because of television or whatever, they're coming in saying, all I need is a neck lift.
Right.
And you say that may be a mistake. Why?
Well, it's not necessarily a mistake, but it may not be the highest priority thing. You see, when we interact as humans, we actually talk with our eyes. Eyes are how you tell if somebody's concerned or tired or angry. After we look at the eyes, we then look at the mouth. The mouth tells you if you're happy or frowning or impish, if you have a little blue box behind your back to give to somebody. We look at that way more than we look at the neck. We don't communicate with our neck. So in terms of bang for the buck, I usually say the eyes hold a priority on the face, as does the mouth, before we get to the neck. Now that doesn't mean your neck doesn't need treatment, but if you just treat maybe the third priority, will your neck look better? Absolutely. But you may not look youthful if you've left untreated.
So you have like
areas.
a 28-year-old neck with old eyes.
Exactly, and that's what we also don't want to do is create a disharmony. It would be almost as if you walked up to a 40 or 50-year-old house and just painted the bottom half of the house. You'd sit there at the curb and go, why did they just paint the bottom half of their house? You know, it creates a little bit of a disharmony that is very eye-catching. So we want to make sure whatever we do, it blends with the whole structure.
Okay, you brought some photos. What are we going to look at?
Okay, Randy, you're going to really love seeing this.
Okay.
So Randy, this patient represents the typical patient that we see.
Okay.
Now, somebody like her will complain of maybe feeling like she's got a stern look or having wrinkles in the forehead, complaining about looking tired in the mirror because of bags under her eyes, or the fact that she might hate her profile view because of the neck sagging and the extra skin. In her situation, we had to do a brow lift, reposition her eyelids, take care of the bags. We had to do a little fat grafting here and there to fill in the little depressions. We did a face and neck lift, tighten the bands, tighten the skin in her neck, did a little wrinkle reduction around the lips to get rid of these lines. Oh, women hate these lines here.
Okay.
And Randy, before I show you this, I want you to realize that every patient that comes to see me, they don't want to look done. They don't want to look like they have had plastic surgery. They want to look great. They want to look natural. They want to look rested.
Okay.
And they don't want their friends to necessarily know what they've had done. So let me show you what she looks like now.
Wow.
What do you
Well, she looks great. There's no doubt about it. She looks great.
You know what's nice about this? A typical patient like
Totally
this.
different, by the way.
Totally different, and yet herself. If you could see a picture of when she was 35, you would see that we're able to make that same person emerge from the previous picture.
Okay, so you got rid of the wrinkly neck. That's gone. Bags under the eyes, which were the biggest thing. I guess you took care of those.
Jowls are elevated. We've restored, do you see the heart-shaped jawline and face that we were talking about? The fullness in the temples, the tapered jaw. It's like the artistic curves, the ogee. You know what an ogee is?
No, I don't.
Ogee is an architectural term for the curve followed by another curve, and you want to have those nice subtle curves. Yeah, when I'm doing the surgery, I actually get down and I move around so I can see, and I adjust the lights so I can see the shine. It's kind of like lining up a putt, if you're a golfer, like Tiger Woods lining up a putt. You want to make sure that all the surfaces are smooth. There's no dents, and there's no contour irregularities. It's a very precise thing that we do.
So when it's all done, she's healed, she comes in, what does she say? Because this is dramatic.
It is hugely dramatic. More than what they say, it's what they do. You will see that when we've hit a home run, the women will start to change their hairstyle to something more flattering. The patients will say that they're happier. I had a patient come in yesterday. Now, she is about as successful as you could be. She's a very well-known attorney. She's successful in life. She's got great friends, great family. And we did a rejuvenation on her, and she said, Gil, I have to tell you, I didn't think this was possible, but I feel better about myself. I have better posture, and people have been saying I'm happier and I'm smiling more. So that's how I get my strokes. It's just, I live vicariously through their successes.
And also when you look at this, if I saw that after photo walking down the street, I wouldn't think she had anything done.
No.
It's very natural. Also, she's prettier.
Absolutely.
In the after. I mean, you've given her a pretty look.
She always was pretty. I've just brought that back out. Yeah, it's a wonderful thing. Now, you know what else? They want to know that they don't have visible scars. So I really work hard. I tell them this, every patient. I say, you know what, I want you to be able to put your hair behind your ears. I want your best friend to be sitting right next to you and be able to look and make sure they don't see any signs that I've been there. That's hard to do.
Now, we talked on the phone, and you said some things I've never heard before. And I think, and I'm paraphrasing you slightly, but it was like there's a lot of pulling going on. And with you like to return tissues to where they used to be. Can you elaborate on that?
Yes. I think there's common knowledge that people don't want the wind-blown look. That's where people just pull and pull and pull.
People meaning other surgeons.
Well, I think even the lay public know about the wind-blown look.
Okay.
And
so that's not just the way they healed, it was the technique of the surgeon that causes that pulled tight look.
To me, that's a failure of concept. So the wind-blown look is an example of imbalance. That's too much of the facial tightening. not enough of the reshaping, not enough of the skin resurfacing. We have to consider a more global rejuvenation. Usually when you see the windblown look, it's too much pull, not enough volume, not enough resurfacing.
People need to know, again, this is a real interview. I'm not siding with you. I'm just asking the questions. But because of the business I'm in, our program airs all over the U.S. And I get to see photos. And no kidding, these are some of the best, if not the best, I've ever seen. And definitely the best in San Diego.
Well, thank you,
So
Randy.
very good work. And because of the sake of time, we have to move on to some other photos. So what else are we looking at?
This is actually the side view, the first patient. And
wow,
boy, tell me what you see there.
Yeah,
I mean,
it's a pretty look.
It's beautiful. Do you see how gorgeous her neckline is? Randy, do you know how many people come into my office every week and they say, I Photoshop my pictures because I can't stand the profile. And,
okay.
And when you give back somebody their neck profile, that's powerful.
You say that's like the party shot. Like when you're at a party, people see you from the side.
Absolutely. Honestly, I have numerous patients every week that say, I Photoshop every picture I'm in, or I just avoid taking pictures.
You know what's amazing? When you look at this, and I'm not trying to be like making it all about appearance, but it's like she looks more sophisticated in the after. It's like she's ready for the polo fields or something. She just looks like almost classier in the after.
She looks regal.
I'm not trying to be shallow here, but I mean, really, it's a different.
I agree with you. There's something about when you look at that longer, more elegant neckline that she just has a more regal appearance. I agree with you.
Okay.
Let me share with you another concept, and that is the concept of I don't have to have everything done to look good.
Okay.
We can be very specific. So in this photo, when you look at certain patients, within 15 seconds, there's going to be a feature that will pop out to me and actually to you that catches your eye. And if we're able to be very specific and treat that.
So that's her under eyes, obviously.
Well, in her case, that's the under eyes, yeah. So a typical patient like that will say, you know what, I feel great, but everyone keeps asking me. I'm tired of everyone asking me if I'm tired.
Okay.
So, in addition to doing her upper and lower eyelid procedure and lifting, I placed a tear trough implant, which is just a volume spacer there.
Wow.
And take a look at that after. Tell me if that doesn't take...
It looks touched up. It's not touched up, right?
None of these are touched up.
Okay.
This, to me, it almost looks like mother turning to daughter. I mean, that's almost what I consider...
And all you did was the eyes?
All I did was the eyes.
And how long will that last?
Here's the beauty. If you do things right and you give her good structure like that, that will last indefinitely.
Okay.
That's bang for your buck. That's one procedure making a huge life change.
Yeah, she looks much younger.
And tell me she's not going to feel better about herself.
Yeah, there's no doubt about it.
Another very typical patient, same thing, just starting to feel like the bags under the eyes are hard to cover with makeup and that the jowls are showing despite, that it's beyond her control. We always start with makeup and change our hair, etc. But there comes a time when you need a little help. So here, what we've done, I hope
very nice.
I hope you like this. Well, take a look at the result, Randy.
Yeah.
I want you to focus on a few things. First, look at the scowl between her eyebrows.
On the before.
Yeah,
okay.
on the before. And you see, we just subtly start to erase that. Now, Randy, look at the before picture under her eyes.
All right.
And now look at the after. Do you see how we've just smoothed that contour?
Yeah, it's very nice.
Yeah, so now your eye doesn't catch it as, ooh, there's something there to catch my eye. It should just look effortless and elegant. And now, speaking of elegant, I want you to look at her jawline in the before. Mm-hmm. See how the jowl is there, and you see that extra skin wrinkling underneath it. Now look in the after. That's an elegant neck and jawline, and that's what we shoot for. Okay. And most importantly, this doesn't look pulled or artificial. It's a very natural look, but a much more rejuvenated appearance. This is one of my very favorites. A typical patient like this is just feeling tired, just wondering what she can do. And actually, she was bothered by these lines here.
Okay.
When I look at her, to me, and maybe to you as well, her eyes really caught my attention. And what we did here is we added volume underneath the eyes. we tightened up her eyelids, and in the process of resuspending and adding structure here, we actually were able to lift up her nasolabial fold. So I want you to look now at her after. You ready for this? This is going to blow your mind.
Goodness.
Now, that to me is a 2-generation change. That's something like almost grandmother to granddaughter appearance. I want you to focus on some real subtleties. First of all, she looks gorgeous.
It's like not even the same person. It's like a complete revamping. It's like a new person. It's very nice.
Now, in the after, I want you to focus on that heart shape I was talking about. Do you see how she always had a beautiful shape to her face? All we did was get rid of the distractions that allow us to see the true beauty that's there. But now look at her upper lids in the before, and then now look at the upper lids afterwards, and you'll see just a little cleaner, a little brighter. Very subtle. That's me. I'm subtle but powerful. Now look at the lower lids. Those bags and the shadowing, those are not subtle, and so there we have to take a little bit more.
So her hair is different. I mean, she's just a different. It looks like it could be the younger sister or the daughter, maybe.
Absolutely, yeah. And again,
do you see this a lot where people kind of change their hair?
Yeah, yes, repeatedly. When people feel good about themselves, they start to dress better. Their posture improves. They change their hairstyle. They smile more.
You say salespeople sell more.
I have a lot of patients that are in they're realtors or they're consultants. No question, I constantly get feedback that people that are in sales, their sales improve. Consultants, I have a gentleman, he's 68 years old. He's a consultant. He came in, we did some fillers. He came back and 6 months later, he said, "You're not going to believe it, but my sales have improved 30%. I went, seriously, how can that happen? He said, nobody wants to take advice from an old guy. They want advice from somebody who's more young and hip and vital. And I think it's accurate reflection.
Now, you're big on fat transfer. You call it fat transfer.
Right.
Taking their fat and putting it under the eyes over fillers. Why is that?
I actually like both. And I think they both have advantages and disadvantages. So when I'm already in the operating room, we're operating, I love using fat. Fat is what we lose in our face, so that's what I want to replace in there. But if you're just walking in between office meetings and you need a little touch-up, fillers are very convenient, they're fast, and they're very effective. You know, I can actually, I had a patient about 2 months ago. She came in and she only had time for one syringe, and she only had enough money for one syringe. And I took one syringe and I put it in there, and she said, "Oh my God, you took off 8 years of off my appearance with 1 cc of filler." Here's a great example of fat transfer. So this patient had been to see a few other people who had recommended surgery on the eyelids. And what struck me was there was some asymmetry of her eyelid folds, and that she was missing fat in the orbits, which is around the eyes. And so without a single incision, this is all just by injection of fat, we placed fat in her upper lids, we placed fat in her lower lids, and we brought a youthfulness and a symmetry and a harmony to her eyes, and brought out the elegance and beauty that was there all along.
Very nice. Now, we are out of time, and I know you have a stack of photos. We have time for just 2 more. So give me some good ones.
Okay. Well, this is another patient, full facial rejuvenation. She has just had a wonderful improvement.
Very nice.
Some people would say she might look tired in the first photo, but in the after you can see the glow. Here's another example of somebody. These are very typical signs of aging. You get the jowls. Sometimes people will complain of looking stern, or I had a patient that said, "You know what? It really hurts my feelings when my children come up to me and say, 'Mommy, why are you always mad? Why do you always look angry?'" And she said, "I'm tired of that. Help me out."
She just kind of cleaned it up a little bit.
Clean it up. And it allows that inner beauty to come out. Here's another one, Randy. I love this one because it just makes her eyes sparkle. Do you see how her eyes just light up in that after
It's very
photo?
nice. Again, it's very subtle. What did you do here? What did you do for this woman?
So I cleaned up her eyelids, and then we lifted her chin and neck, and just allowed that inner beauty to come out. You know, I have a number of patients who are let's say in their 40s, and I want you to look, Randy, at these little skin lines here. This is something, when you're thin, you're athletic, and you're, you know, in your 40s, but you start to show your
right there at the
aging
sides
right
of the mouth.
there on the sides of the mouth. And so for her, what we did is we did what we call the Changes Rapid Lift. That's a facelift under local. You come in, you walk in, we lift you, send you right out. It's a quick recovery, but the results are dramatic. Do you
Very
see
nice.
do you see, Randy, in the afters how those lines are gone? Mm-hmm. Now we also, because she had a lot of sun exposure, we did a little chemical peel at the same time, and her skin looks so radiant. It's beautiful. And here's just one more example of the same thing. Again, an absolutely beautiful woman, but she complained of these lines around the cheeks. Now these women are thin, they're active, and they just can't stand those little wrinkles.
Yeah, it's gone now, completely.
So we do the Changes Rapid Lift, a little light chemical
You invented
peel.
the Changes Rapid Lift,
I did.
you said.
I did, yeah. So it's a wonderful procedure because it's done under local anesthesia. It has fantastic results that last a long time. Typical mini lifts have a very short duration of action. This will actually be very powerful and long-lasting.
We are completely out of time.
Hey, Randy, can I show you one more, please?
Okay, one more photo.
All
one
right.
more photo.
This one means a lot to me because this is a really good friend of mine, and she's absolutely beautiful inside. And the thing that she was just noting was that she just had a heaviness on the lower part of her face, and her nose was a little bit drooping. And so she just asked me what I could do, and this speaks to the shaping and proportion. So I think you'll like this because there's a subtlety to it. But it sure allows. Take a look. Take a look at the
Wow.
after. Doesn't that look great?
And what did you do? So you addressed her nose?
So I
her
reshaped
neck?
her nose. I did a little chin implant, and then we sculpted her neck. And I want you to look at the sparkle in her eye afterwards.
Okay, you're right about that.
And there's something to it. When you do these little procedures, their eyes sparkle, and that's how we communicate, is through the eyes. And it just allows this inner glow to come through.
And we're out of time. So final message to a woman or even a man, they don't like the way they're aging. What do you say?
I would say, come in, let's meet. It's actually a fun time. We'll do the 3D imaging, and you'll have a chance to take a glimpse at your future.
Okay, great. I want to thank you for coming to the show. Very interesting, and thanks for finally coming over.
I'm thrilled to be here. Thanks so much for having me, Randy.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.